Assalamu alaikum. Now we are going to continue drug distribution. This is the second phase for pharmacokinetics. We have finished drug absorption and now the drug has reached our systemic circulation. When it has been reached in our systemic circulation, it should be distributed. This is the phenomena when the drug leaves the bloodstream and enters the extracellular fluid. The distribution of the drug from plasma to interstitium, it depends especially on the cardiac output and blood flow, capillary permeability, tissue volume, degree of binding of the drug to the plasma, tissue proteins, and relative lipophilicity of the drug. Now this is a graph. It shows that when you have given the IV bolus, the drug concentration is seen after a single injection of the drug, and this is the elimination phase. Drug distributes and drug enters the systemic circulation. When we have given IV, there is no absorption phase, and then it is subsequently eliminated. Now the first factor is the blood flow. The rate of the blood flow to the tissue capillaries, it varies widely. Now there are some vessel-rich organs such as brain, liver and kidney. Adipose tissue, skin, viscera have still lower rates for the blood flow. Variation in the blood flow means short duration of hypnosis produced by IV bolus of propofol. We will see in the next chapter. Together with lipophilicity permits rapid distribution into the CNS and produces anesthesia. Lower distribution to the skeletal muscles, adipose tissue, it lowers the plasma concentration, so the drug diffuses out of the CNS down the concentration gradient and consciousness is regained. This is its phenomena. Now capillary permeability, it is determined by the capillary structure and chemical nature of the drug, the two things. Now we can see in the brain the capillary structure is continuous and there are no slit junctions. To enter the brain, drug must pass endothelial cells of the CNS capillaries or undergo active transport. For example, a specific transporter carries levodopa to the brain. Lipid-soluble drugs readily penetrate the CNS. Now let's have a look at this. This is the structure of the liver capillary and this is the structure of brain capillary, and let's make it larger. Now you can see large fenestrations allow the drug to move between blood and interstitium of the blood. These are the large areas to allow the drug passage, drug distribution. But for the brain, there are very tight junctions. And this is determined by the permeability of a brain capillary. Charged drug will go inside lipid soluble drugs and carrier mediated transport. These two are the transport systems for the drugs. Okay, now we will have a look at the binding of drugs to the plasma protein and tissue. Reversible binding to the plasma proteins in a non-diffusible forms and it slows transfer out of the compartment. Now albumin is the major drug binding protein, you have to remember this, and it acts as a drug reservoir too. Concentration of the free drug decreases due to elimination. The bound drug dissociates from albumin. This maintains the free drug concentration as a constant fraction of total drug in plasma. Now this was binding to the plasma proteins and now binding to the plasma to the tissue proteins. Now many drugs will accumulate in the tissues. It will lead to higher concentration. Drugs which accumulate is due to the binding to lipids, proteins or nucleic acids. Drugs may also go active transport. Tissue reservoirs are the major source for the drug and it prolongs its actions or it may cause local drug toxicity. Now lipophilicity. This is a common factor. It is a chemical nature of the drug. It facilitates the movement across the biological membranes. Next is volume of distribution in the next lecture.